Hi, this is Dale, your librarian. You can reach out to me at dale.larson@utah.edu. I am here to give you some strategies for figuring out how to find what you're looking for. And I had a tough time finding stuff like that too. So, for what it's worth, if you want to feel better about that. But I do have a couple of strategies for you to pursue. But let's go back and forth via email. And we can do this together, or you and I can meet over Zoom or in person here at the library. You get to let me know, but I'm here with you for the long run, so you can get that done. And congratulations that you are presenting at a conference. Well done. So when you're looking for something in the library catalog, we know that it's not a smart search. So if I type in drug addiction, it's only going to find things that have substance abuse in them if those words are already used. And so we get into the weeds of like, well, what keywords are going to work? And so what you would have to do is come up with synonyms or related terms. And I think you've done a good job of this. So you do an or, and then I put it in quote marks so those two words stick together. So we went from 78,000 articles to, drum roll, 341,000. So it depends on the words that you use. So one recommendation that I've got is I took the text of the message that you sent to me and I put it in an AI. I'm using Google Gemini for this one. But you can say, what are legal terms related to involuntary treatment for at a clinic. So when I say terms, I'm just like, give me some keywords, Gemini. And here you can get all sorts of different things that gravely disabled. That sounds terrible. And you can get some acts and laws and all sorts of different things. So what I've done is I've gone to, and I have notes on my monitor over here, and I've gone and strategized and figured out a good set of keywords to kind of get us going. But then the second thing that I would recommend is going to different databases. So I have a list of databases to recommend. So databases are right here. And you can go in by medicine or sociology or public policy. And I'll show you my favorites. To follow along with me, you can pause the video if you want to. But if you go to research guides over there, search for social work. Click on the big social work and then go to, you could either do PhD and master's help. Yeah, let's use PhD and master's help. So finding more keywords, we just did that, but here's some more ideas for looking at it. So the more you get into the topic, the more you'll find these little esoteric little keywords that people are coming with. Also, if you speak another language or if you can read and write in another language, there's studies from all over the place that are working on this. So drug addiction interventions have been a thing that have been very progressive in different places. So for example, what was it? Uruguay was the first country in South America to legalize marijuana. I think that was right, wasn't it? But you could find evidence of that in here. And then if you spoke Spanish, or you could write Spanish, or you could even use Google Translate, then you could look up Uruguay and see how they worked with stuff like that. So for what it's worth, finding more keywords. Then there are my favorite databases. So that was that list that I was showing you earlier. I'm going to show you a few of my favorites, but I would encourage you to just cruise around and see which ones you like the best. So the first one that I love is PAIS. PAIS, if I open this in a new tab, it's the same thing. There I was trying to spell fourth in a different search. I misspelled fourth in Spanish for another patron. When you go to the advanced search, oh, here's all of my keywords. I was going to load these ahead of time. Okay, I'm going to close that for a second. Let me tell you what I was doing. I looked for, I'm looking at my monitor over here. There was like treatment centers, hospitals, and things like that. That was really weighing me down. So the first thing I did is I tried to find everything that had substance abuse or synonyms and related terms. So this is where the or came in. And then I found too much stuff. So I looked in the abstract only. And then in the second line, then I was trying to find the key terms related to publicly funded. So I did state-run, state-funded. Public funding, you get the idea. The big one was public health. That sometimes looks at things going on like an epidemic or something like that. And it's based on policy, but oftentimes I feel like it infers that it's publicly funded, so that one may be problematic. So when I searched for those, and I'll send you these keywords, when I looked for those in a public policy database, we'll get a lot of data. So here's people who got arrested for smoking. I don't know if that was just cigarettes. There's a longitudinal study from Australia, methadone maintenance treatment in Spain. So it's all over the place. Croatia. But, so if you're, oh, here we go. Ooh, illicit drug prices. So what we have is we have this one thing going on that can be described by all of the different keywords that we had. So there might, it seems likely that we won't find anything that looks exactly at what you're looking at, but you might find supporting evidence from one aspect and from another aspect and from another aspect. So what I would do, this changed everything dramatically. Oh, hey, let me add my final bit to the search. So you can add a row to narrow it down even further. And for this one, oh, I've got some sweet keywords I looked up in AI. And let me show you another strategy. When I'm adding these, I want this to say, okay, I want to find stuff with that and this all together. So when I say I'm looking anywhere, that means it's going to be in the title, the abstract, sometimes full text or other descriptions. And now it's choking on my massive search. There we go, 365. So you could go through these. So there's like prevention programs, but you're looking at like intervention programs. They're not always going to say intervention. So what I would do is narrow it down. So we could go like ultra narrow and say the hospital or treatment center, that has to be in the title. So not just the abstract, has to be like the most important thing, or it's in the title. And that narrows you down to 12. So you get to decide for any of these what the most important thing is. And then, oh, excuse me, what you could do is you could keep on modifying till you get what you wanted. So I want peer-reviewed, and I want something from the last 3 years. We'll just leave that in the abstract. And after a while, you'll get to these things that are more focused on what you're interested in based on the keywords. So here's racial and gender differences in treatment acceptance in rural residents. Oh, it actually looks pretty good. Let's take a look at it. Where is, oh, here we go. Sometimes the full text is hidden off on these full text option things over here. When you click on this, it'll send you to a place that maybe will show you databases. And so if you get stuck, after like 30 seconds, if you can't find it, just send me the citation and I'll track it down for you. So this one, what you would be looking for is where this population was studied, what was going on, the timeline that they were working in, and then what you can do if you find something really good, you can look at their methodology and see what populations they looked at. You can see variables, you can see the raw data, but at the tail end in the discussion, you can find those golden nuggets of like, this is what this means. So for example, Here they're talking about education level, but if you have a lower educational attainment, it seems like those treatment programs are going to work, or they're going to be less successful. Is that a deal breaker? Maybe you have to find economic. So this is where you would go back and do another search for like economic or something like that. So let's go back. Let me show you another database. PAIS, I adore. Another one that I really like is the people who might put an at-risk person in an intervention program. So that would be like CINAHL would be nursing. So let's try those same keywords. But in this context, instead of public policy, these are medical professionals who are seeing somebody at a hospital for one, or a clinic for one reason or another, and they're recognizing that maybe something else is going on. And we can do that. So, whoa, we could do that same search. And we'll get some stuff that's the same and some stuff that's different. Ooh, there's risk assessment, community violence, social isolation. Ooh, family determinants. Even though it's among Rwandan youths, there are correlations. I mean, we're all human, is the idea. Let me show you another one that I really like. So, okay, I'm not going to show you each one of these, but I would try sociological abstracts, social science premium collection. Social work abstracts is okay, but you're not going to find a lot in there. PsycInfo is psychology, where people are actually the evidence-based practitioners making recommendations and building the criteria for admittance or involuntary treatment programs. So several of these are really good to look at. But the last one I want to show you is if you go to Scopus or Web of Science, they both work in a similar way. I'm going to close some of these other windows. Scopus and Web of Science go across all the disciplines, including like STEM, health sciences, social sciences, and humanities. And you can still do these searches, and they have this neat tool. So let me show you what I'm talking about. And maybe you could like fast forward. I'm not a clever YouTube editor. Abstract, abstract, abstract. Okay, same search, different content. Scopus is like the top of the line journals across all the disciplines. But what you can do in this one that's unique for other ones is you can see the number of times that something has been cited. So we can see that this article that was just published this year, treatment acceptance on a health belief model. So this might be like an intervention. This one has 0 citations because it's brand new, but we can do this sorting option by the number of times cited. Then all of a sudden we can get things that have been cited a lot. Furthermore, we can come up from, let's come up to like 2010 and see. So these are treatments, and sometimes the treatments are something that makes it more affordable. But wait, there's more. Let's add another one. Let's do government or policy or legal or law, and have that be anywhere. Ooh, let's have that be in, oh, or no, not accountability. Let's put that in the article title. 450. This is where you start to get into the nitty-gritty of things that you might have been more interested in, where they're like, has a prescription law helped? Hospital admission rates after policy changes. So PAIS is pretty good, but this one is good if you sort by the number of times cited. Then you can see the articles that are the most impactful. Also, community-based coalitions, that one looks really good. When you click on the title, you'll see this View PDF over here. Again, sometimes you get the PDF and sometimes it sends you to the library catalog. Your results may vary. Okay, this was a long video. Let me know how it goes, but there should be a lot of information, and I'll keep on thinking about where else we can look for stuff like this.